Good afternoon, everyone. So the last topic for today is medical nutrition therapy in gestational diabetes mellitus. Although Vandana has told in detail about everything, but MNT has its own importance and it should be individualized. So nutritional assessment in GDM should be individualized. This includes defining her body mass index or percentage of desirable pre-pregnancy body weight and optimal pattern of weight gain during pregnancy. Calories and GDM individualization is important when determining energy requirement, and adjustments should be made based on weight change patterns. Energy requirements during pregnancy include the normal requirement of adult and an additional requirement for fetal growth plus the increase in the body weight of pregnant woman. Energy requirements does not increase in the first trimester unless a woman is underweight. Energy requirements increases during second and third trimester. Energy intake should be adequate enough to provide appropriate weight gain during pregnancy. So the importance of individualized nutrition is, as per ICMR guidelines, for an average weight gain of 10 to 12 kgs, an addition of 350 kilocalories per day above the adult requirement is recommended during second and third trimester. Severe caloric restriction is not recommended as it may result in ketonemia and ketonuria and impair physical and mental development in the offspring. So the recommendation for a sedentary worker is 900 kilocalories plus 350. For moderate worker, 2230 plus 350. And for heavy worker, 2850 plus addition of 350. So diagnosis and management of gestational diabetes, technical and operational guidelines. So further addition or deduction of 500 calories per day is recommended as per following table. So if the patient is underweight, an addition of 500 kilocalories per day is recommended. For obese, if they are more than 25, energy requirement as per level of activity minus 500 kilocalories per day is recommended. So this is another way by which we can calculate the dose of the calories for any of the patient of GDM. Hypocaloric diets in obese women with GDM can adversely impair fetal growth besides ketonemia and ketonuria. However, moderate caloric restriction, reduction by 30% of estimated energy needs in obese women with GDM may improve glycemic control without ketonemia and reduce maternal weight gain. So out of the diet, carbohydrates should be 50 to 60%, proteins 20 to 25%, and fats 25%. So by rough estimates, if we go by the plate method, which is very convenient for teaching our general population, so diet should ideally be prescribed by the dietitian as per the patient's pre-pregnancy BMI if available. Meal plans should be divided into the 3 major meals: breakfast, lunch and dinner, and 2 to 3 snacks in between them. Women should eat food which is easily available at her home with little modification in the diet, like she should reduce the number of chapatis she has in one meal at one time. She should eat either rice or chapati. And the woman should follow discipline regarding the meal timings. Eat food at the same time daily if possible. Avoid fried foods, sweets, juices, red and organ meats. Meal thali should be divided into 2 halves. Fill one half with vegetables, salads and fruits. Divide the other half in 2 equal halves, one for dal and other meat products if she is eating, curd and other half for roti or rice. She should include all food groups in her daily diet, that is cereal, whole grains, pulses, milk and milk products, fruits, vegetables and little amount of fat. The woman must drink water, buttermilk, soups, soya milk and other unsweetened healthy beverages instead of soda or fruit juices. So this is the 1800 calorie sample diet as prescribed by the Government of India guidelines. So we all know about it. At the breakfast, you can all read this and it is available easily on the net. So you can go through it. So it is basically that she has to have 3 main meals and 3 snacks. And the snacks should not be containing too much of oil, or they should not be the fried things, or calorie dense diet should not be given. So some insight should be given to the patient as to which are the high glycemic index foods and which should be avoided. That is very, very important. So each patient requires individual counseling about the diet. So this is another diet plan which has been recommended by the Government of India, that is 2,000 calories sample meal plan. So this also includes the 3 main meals and 3 snacks, but the calorie intake is little more than what it has been prescribed for 1800 kilocalories. So this is food exchange list of commonly eaten items, because nobody can eat the same food every day. So they can be allowed to do exchanges according to this chart, which is very, very convenient for them. So whatever they are eating every day, they can exchange that food with the other of the same calorie intake. So physical activity and exercise for women of GDM. Exercise may provide maternal benefits, minimize weight gain, improve glycemic control, and prepare for physical rigor of labor. Fetal benefits include potential reduction in the fetal adiposity. Schedule of exercise, schedule planned physical activity should be for 20 to 30 minutes daily, at least 5 times a week. Moderate exercise with low fall risk should be advised. Most days of a week in the absence of contraindications. Carbohydrate-based snack prior to exercise may be needed.